Bedsores, also known as pressure ulcers, are a serious medical condition that can affect individuals who spend extended periods in one position, particularly those with limited mobility. These sores typically develop when prolonged pressure reduces blood flow to the skin and underlying tissues. Over time, this lack of circulation can cause tissue damage, leading to painful wounds that require careful treatment and monitoring. For individuals living with bed sores or conditions that increase the risk of developing them, daily activities can become significantly more challenging. Something as simple as walking across a large parking lot may increase discomfort, prolong healing time, or worsen existing wounds. In situations like these, a disabled parking permit can provide important support by improving accessibility and reducing physical strain. Understanding the connection between mobility challenges, bed sores, and accessible parking can help patients and caregivers recognize how parking accommodations can support recovery and overall well-being. Bed sores most commonly occur in people who are unable to move frequently on their own. This includes individuals who use wheelchairs, people recovering from major surgery, and those who spend extended periods in bed due to illness or injury. Individuals with spinal cord injuries or neurological conditions may also be at higher risk. The most common areas where bed sores develop include parts of the body where bones are close to the skin, such as the hips, tailbone, heels, elbows, and shoulder blades. These areas experience the greatest pressure when someone remains seated or lying down for long periods. Symptoms of bed sores can vary depending on their severity. Early signs may include redness, tenderness, or changes in skin texture. As the condition progresses, the skin may break open and form painful wounds that require medical treatment. Because pressure ulcers can worsen if additional strain or friction is placed on the affected area, reducing unnecessary movement and physical stress is often an important part of treatment and prevention. For individuals living with bed sores, traveling to medical appointments, rehabilitation sessions, or everyday destinations can become difficult. Walking long distances can increase pressure on sensitive areas and may slow the healing process. This is where accessible parking becomes especially helpful. A disabled parking permit allows individuals with mobility limitations to park in designated accessible parking spaces. These spaces are usually located close to building entrances and are designed to reduce walking distance for people who have difficulty moving comfortably. By allowing patients to park closer to their destination, accessible parking helps reduce the amount of physical stress placed on the body. This can be particularly beneficial for individuals managing bed sores, as minimizing pressure and movement can support healing and reduce pain. Accessible parking spaces are also designed with additional room to allow safer entry and exit from vehicles. Many accessible spaces include adjacent access aisles marked with diagonal striping. These access aisles provide extra space for wheelchairs, mobility aids, and careful transfers. For individuals who need to adjust their seating position or move slowly when exiting a vehicle, the additional space can make a significant difference. In addition to supporting comfort, accessible parking can also improve safety. People with bed sores may need to move carefully to avoid irritating affected areas. Navigating crowded parking lots or walking long distances over uneven surfaces can increase the risk of falls or additional injury. Parking closer to entrances helps reduce these risks by shortening the distance patients must travel. Patients recovering from surgeries or medical conditions that lead to bed sores may qualify for either temporary or permanent disability parking permits, depending on their medical situation. Temporary permits are often issued when a mobility limitation is expected to improve over time. For example, someone recovering from surgery or dealing with short-term pressure ulcers may qualify for a temporary permit during the healing process. Permanent permits are typically issued for long-term conditions that significantly limit mobility. Individuals with chronic medical conditions or severe mobility impairments that increase the risk of recurring pressure ulcers may qualify for a permanent permit if their healthcare provider determines that their mobility limitations are ongoing. Obtaining a disability parking permit usually requires medical certification from a licensed healthcare provider. A doctor, nurse practitioner, or other authorized medical professional must confirm that the patient has a medical condition that significantly limits mobility. The healthcare provider will typically complete a section of the application, verifying the diagnosis and explaining how the condition affects the patient's ability to walk or move safely over distances. Once the application is submitted to the appropriate state agency, usually the Department of Motor Vehicles or a similar transportation authority, the permit may be issued after review. Once approved, the permit must be displayed clearly whenever the vehicle is parked in a designated accessible parking space. Display rules vary slightly depending on state regulations, but the permit must always be visible, so parking enforcement officers can confirm that the space is being used legally. It is also important to remember that disability parking permits are issued to individuals, not vehicles. This means the permit can be used in any vehicle as long as the eligible individual is present in the vehicle. For example, if a caregiver or family member is driving a patient to a medical appointment, the permit can be used as long as the patient is in the vehicle. However, the permit should never be used when the eligible individual is not present. Misuse of a disability parking permit can lead to fines or penalties. Caregivers often play an important role in helping individuals with bedsores manage their condition and maintain mobility. Assisting with transportation, medical visits, and daily errands can be physically demanding for patients who are already dealing with pain and limited movement. Accessible parking helps caregivers provide support more efficiently by reducing the distance patients must travel between the vehicle and their destination. Beyond convenience, accessible parking can contribute to improved quality of life for individuals managing pressure ulcers. Reducing unnecessary strain allows patients to focus more on healing and recovery. Patients who can travel more comfortably may also be more likely to attend follow-up medical appointments, physical therapy sessions, and other important treatments. Bedsores can be a serious medical condition that requires careful attention and ongoing care. Managing pressure, reducing strain, and supporting mobility are all important parts of preventing complications and promoting recovery. Accessible parking permits offer a practical way to support individuals dealing with mobility limitations caused by pressure ulcers or related medical conditions. By allowing closer access to buildings and providing additional space for safe movement, accessible parking helps individuals maintain independence while protecting their health. For patients living with bedsores or caregivers assisting them, understanding the benefits of disability parking permits can make daily life safer, more manageable, and more comfortable during the recovery process. We hope this video helped answer your questions. If you need a handicapped placard or plate and want to avoid the confusion and long wait times, visit handicappedparking.com. Our licensed doctors are available online to help you from the comfort of your home, making the process simple and stress-free. Subscribe for more helpful information on disabled parking permits, and leave a comment if you have any questions. Thanks for watching, and we'll see you in the next video.